Um, so hello everybody, welcome to a rather nice sunny day for a change across the country by the looks of it, because it's got a beautiful blue sky over there. Um, I'm Chris Carrigan, I'm the data advisor for Use My Data, and we put these sessions on roughly once every 3 weeks, depending on availability and other things. All the topics come from members, anybody. This one came from two people who independently emailed me and said, what's the new government? How does it relate to patient data and what sort of impact might it have on patient data? Um, which was fortunate because I also went to a presentation with Understanding Patient Data because I'm on their board, and they had similar conversations. I'll make reference to what I heard at that meeting during here. So perfect timing. Same, I'll talk for about 20 minutes covering what I've seen and picked up from media and policy and other statements. And the rest of the time will be us Q&A discussions. It'll be really interesting to hear what you think about things that you picked up in the local media or the national media or elsewhere from a data perspective about the new government. So this is just my apolitical take on what I've seen or read or heard or gleaned around the impact of general election, new Labour government on patient data specifically. There'll be things I've missed, so your views at the end will be really interesting. And there are things that you may interpret differently than the way I've interpreted them. And again, just shout up. So thanks, first of all. This is where I got the stuff from. So Olivia is the lady I mentioned at Understanding Patient Data, who had also done a presentation for the last Understanding Patient Data board, which I'm on. And I'm gleaning some of the things from her. So thanks to Olivia. And I did talk to her about this. She couldn't come because she does other work on a Friday, which is a shame. Other sources are the ones which we often use, or Elizabeth often used to pull for the newsletter. Things like Digital Health Magazine, Wired Magazine, all online. And then the various UK government and other devolved nation websites, as well as Labour Party manifesto. So that's basically the place I've been to look for and grab some of this stuff. I've also gone to various other bits of media which I've picked up as well. So let's start first of all around the basics. Who's who? So this is my current list of who's who in the government world, particularly in relation to patient data. Obviously, we've got Wes Streeting as the new Health and Social Care Secretary. Working for him, the notable ones, Karen Smith, Minister for State for Health. If you look at the website, there's a list of things that their portfolios cover, and I've picked out a few of them. This is not the entirety, but the interesting ones were she's going to cover NHS data and technology, cybersecurity, and the federated data platform. They were specifically mentioned. Now, some of those will apply to the UK, some will be just to England, and I'll come back to that in a minute. So if you want to go on the government website, you can see all the different areas that each of the individuals cover. And there's a link, I think, in my slides as well, that you can have afterwards. The second one mentioned was Andrew Gwynn around public health and prevention. There wasn't anything specific around patient data in his portfolio, but equally, prevention relies on use of patient data, as does public health. But there's nothing specific about data within his portfolio. There was in Stephen Kinnock, Minister of State for Care, because that covers adult social care, and the adult social care does have some elements around its responsibility around data, technology and innovation, and indeed primary care. So you can see there's a mix in terms of a patient data perspective about which minister is responsible for who or which bit. So we need to think if we've got a particular topic area, who we go to first, and there may be one or two there. It's useful to know. Click on. Wales is slightly different. So Eleanor Morgan is current Cabinet Secretary for Health, Social Care. Their website is really very good because it's quite detailed in terms of the coverage that each of the posts includes. And I've, again, picked out a selection of those, full oversight of NHS Wales, as you would expect, but there are specific mentions on primary care, R&D, research and development, health, digital and technology and innovation. And interestingly, patient experience and involvement, that's the only mention of patient experience and involvement in any of the cabinet briefs or the ministerial briefs that I've seen so far, which was encouraging. I think Wales have put a good degree of effort over the past few years into involving patients in the way they begin to use their data. And the Sale Data Bank, they've done a presentation with us previously, is a good example of how the Welsh government and health service have pulled their data together nationally and used it for some really good, clever means, but have involved patients and the public in that dialogue as they've developed it. So it was good to see patient experience and involvement in that specifically. Worth noting that as I understand it, the Senate's been recalled on 6th of August. where they're likely to have Eleanor Morgan imposed changed to be their new Welsh First Minister, which means somebody else will pick up the health and social care brief, but the contents, I suspect, will stay the same. Again, Scotland, slightly different. The two people mentioned there, Neil Gray, Cabinet Secretary of Health and Social Care. The bits in the brief for Neil Gray specifically include e-health and primary care and GPs. And from Jenny Minto's perspective on public health and women's health, it specifically mentions medical records, My NHS Digital, which I need to look up, I have to say, and the general concept of population health. So again, in a data perspective, both those will be really heavily involved in having data to help with their brief. And finally, Northern Ireland. If you look at a Northern Ireland site, there is one person mentioned, Mike Nesbitt, who's the minister. There isn't any detail on there about what that includes in the portfolio. In general, the Northern Ireland site for this was much more difficult to get through. There was less in there than the other parts of the UK. So those are the people involved. In terms of what they're going to represent, so the policy pledges, and this is pulled largely from the original Labour Party policy paper, Build an NHS Fit for the Future. That's a clickable link. If you Google it, you'll also find it very easily. It's quite a large paper, but I've picked out what the broad themes are, which were three. Enabling more people to get care at home in their community, building the workforce of the future with the technology they need, and an increased focus on disease prevention. Now, none of those specifically mention data, but there are data angles within each of those themes as you work through the paper, which you'll see. So specifically related to patient data, when you look through that policy document, there are a few key things which pick up. Now, I wasn't largely surprised by what I saw, and I suspect if you look at the other manifesto papers from the other political parties, you'd probably see much the same things because they are basic principles, but it's worth having in there. So first of all, the recognition that the NHS data set is unique. The thing to think about there is what do they mean by the NHS? Because we've already seen we've got UK government, we've got devolved administrations, we've got different NHS data controllers across those different devolved nations. So when we talk about the NHS data sets, it's a little simplistic because the NHS isn't one NHS in the same way. The data set isn't the same NHS data set in the same way. And there are different bodies which control those country-specific data sets. But what they've said is perfectly true. It is unique. The key thing, as you'll see on some comments later from where people put some commentaries in, is that we're not making use of that NHS data set at a national or a UK specific, particularly a UK level. Some of the points which I thought were interesting were around history. So we acknowledge that history shows us getting data innovation right. It's not easy. I think it was really important to see that in there. Those who've been around long enough to know previous national, particularly national data initiatives in England have not gone awfully successfully. So the fact that one of the incoming government has recognised that the way things ran in the past might not be the way we want to run things in the future, I think is real encouragement. What that means is difficult to find out, but you know the statement is in there. Similarly, recognition that the data is there, but we're not using it, and different parts of the system are not using the information. So the key point from that was, I have to say, I've seen this a few times in different policy and different strategy documents, that's the power of data, harnessing the power of data. And this point about interoperability. So interoperability means that different parts of the NHS which use our data should be able to share, to utilize data which is held by another part of the system. And that generally doesn't work. So data gets shared because it's not interoperable. It's not able to see one bit of data easily, which sits in another piece of the NHS infrastructure. So one hospital in Devon would have great difficulty in seeing my medical records in Sheffield because they're not interoperable. And what the NHS has done for a long time is to extract data from each of those two systems, Devon and Sheffield, and put them in one place so you can see the whole thing. But that's duplication. That's not particularly interoperable. That's more a traditional way of pooling national data. And that still happens a lot. The other point about interoperability that's mentioned in the policy documents is there's a huge focus on the NHS app and making the NHS app pivotal. So it puts the NHS app at the heart of this. I think I've got a few more points about that later. The other statement that is made is all the data would be owned by the patient. I think the word owned is a tricky one, but clearly they're trying to put the patient at the heart of this. What it means, again, don't quite know yet. The point about interoperability is also picked up in the next bullet point about a centralized direction for future procurement of data systems. So if you let every hospital procure or develop their own IT system, none of them will talk together. Now, there are standards in place happening for many years to try and minimize that, but they never really worked properly in terms of being able to really share interactively between Devon and Sheffield. If I go to a hospital in Devon when I'm on holiday. So that's what interoperability is trying to do. And one of the points that picked up in the policy documents is you're going to have some form of centralized direction. And the word direction is important here, but it's not just advice, it's you must do for future procurement of data systems. I have to say, I've seen that a few times in the past. It is incredibly difficult to actually make happen and incredibly time consuming. So the average hospital IT system, if my local hospital goes out and says we need a new system to run across our hospitals in Sheffield and the localities, that will probably take between 5 and 10 years to get working. So this is a long-term thing. Don't expect things to change quickly. And the other point at the bottom, we'll explore how to make data sets more open to businesses. So one of the concerns when public surveys go out is, oh, who's seen the data, and our pharmaceutical companies, our commercial companies, our insurance companies being able to see my data. Now, there's a push in the policy documents to make data sets more available to businesses, researchers, and others, including ourselves. But it equally is caveated by it needs to be done in the right way with the right governance. So I don't think there's anything new in there, but it was important to say that data needs to be used for our benefit and the public benefit by others rather than just inside the NHS. I think there's a fair amount of public communications needs to be done to develop that message, frankly. Topical one is artificial intelligence. There are some points in there about making sure the UK is at the forefront of work on AI. I think I see that in every document I've seen, every political party, every piece of paper I've seen around this. We need to make the UK the heart of AI. How that happens, well, again, a detail to be developed. But the interesting thing was there's a commitment to say we'll do this with transparency and building trust, So I think that's important, but again, how that happens is really, really difficult to define. There's no detail in there yet. So how you develop an infrastructure where artificial intelligence can go and generate all these new concepts in a way which is transparent and clear and builds trust is really tough. There's a lot to do on that. Another important one was around the opportunity for each of us to participate in clinical research. So it specifically mentions clinical trials, registries. There's been an opportunity to change this. The fact that some registries exist, they're not joined up, a fairly topical theme. But it does say we'll bring these together to create standing national registries to enable people to sign up to certain things. This is sort of a UK perspective view, but there are different ways in the way that's been done or could be done in Scotland, who've been quite active in getting people to sign up proactively to research registries. Importantly, there's a message in there that says the UK government will work with all the devolved nations so patients can access clinical trials regardless of which part of the NHS, which devolved nation they reside in. I think that's really important to have that in there. Again, how that gets done will take some time, but I think having that in there as a stake in the ground was a really important thing. This was slightly tangential. This was something that Olivia picked up from understanding patient data. The statement that a national data library would be developed, and you can see the quotations there from the Labour Party manifesto to bring together existing research programs. You can read the rest. I'm not quite sure what that is yet. I think the focus of that is on the wider life sciences industrial strategies, not just health. But obviously, health is massive amounts of data in health, and there could be some real benefits in linking health data with other types of data. But at the moment, there's a real lack of certainty about what that actually means. I don't know what a library would look like, what would be in it, what wouldn't be in it, how the safeguards will be placed, who'll be in charge of it. So I think the fact that it's stated there means we need to watch for what gets discussed around that. But at the moment, I've not been able to find anything about that particularly. So some commentaries that are picked up based on the policy documents and the first few days, weeks of the new government. There's a real key thing around public finances. So we know that public finances are in a difficult position after the pandemic and after a fairly large period of financial uncertainty and stability. I think as all countries are going through. So there's a real issue around whether public finances will stifle that ambition. And one of the quotations, this is from the Digital Health Online, that the NHS estimates it will need an extra 30 to 40,000 digital and data experts by 2030. Now, that's not a cheap thing to get. They're not easy people to find. If you're trying to begin to find them tomorrow, it'll cost you a lot of money. But there's clearly a statement there that says if you're going to make best use of health data, you're going to need a lot more bums on seats to do that. There is no clarity about where those bums on seats will be inside the NHS, in universities, in other commercial companies, in partnerships. But it's an interesting conclusion that Digital Health drew, which is if you're going to be ambitious about data, you need to be ambitious about the people who can utilize the data. We've seen that in smaller scales into cancer, for instance, a good example where the number of cancer analytical bums on seats is probably a regulating factor at the minute to how best we can use the cancer data. That's one specific disease area, whether it's processing the data, analysing it, or indeed making it available to other researchers. So this is a really big issue that needs to be addressed. So expect some updates on workforce and workforce strategy soon, I would think. I've sort of mentioned this before about making the UK life sciences and medical technology superpower. Typo in my headline, sorry. I think it's just it's a statement of intention. We want to make the UK superpower. We want to embrace our life sciences. We want to use the data. We might need a more effective culture of innovation. Again, I think everybody pre-government said exactly the same thing. The question is, how do you do that? We all want to be a superpower, but how do you do that? What's it going to take? So the devil's in the detail with these things. That needs a lot more detail about how that might happen. But it's clear intention that it will happen. Oops. Just want to move off to a couple of slightly tangential things. So what I thought was interesting was NHS England put out a statement. It's on their website. You can read it. That basically said, yeah, this is great. And our existing infrastructure within NHS England, the Data Research and Development Programme, aligns perfectly with the government's key missions. So they wouldn't have just put this out in isolation. They clearly have NHS England very clearly tied into NHS and policy and ministers. So they put this out, I think, with the backing of the ministers that says, yeah, we think this is good. The Data for R&D programme sounds like it's doing the right thing. So it is in line with what we've said. The important thing for me is that it gives a level of stability and continuity about what's happening. Admittedly, this is just England, but there's an interesting position NHS England in this case have taken that says we've upped ourselves about what the new government have said their intentions are, and we think we're ideally placed to deliver that as we currently stand. So interesting. Let's see how that develops. What it does say is that the two big national bits of data infrastructure, again within England, the Federated Data Platform and secure data environments more generally, seem to have got some support. So West Streeting was claimed slamming, this was the press wording, not mine, the glacial pace of the FDP, the Federated Data Platform adoption. The Federated Data Platform is a thing that helps the NHS run itself. It's a new piece of software just rolling out. This is where the Palantir company have developed a software and have got the contract to deliver this across the NHS. It's software that allows the NHS to utilize its data better and does have a large focus on interoperability across all hospital and all care providers. And West Streeting has clearly said it's going too slow, that we need to move it on a bit, because he can clearly see general practice data as a key to unlocking better population health outcomes. I think I'd agree with him on that, my personal perspective. It's of vital importance to patients. So I think from policy perspective, it's really interesting to see the take on that. And I put two links in there, two stories which cover that. But again, continuity, keeping things going without making wholesale change is interesting. And just yesterday morning into the Health Service Journal, my little email updates popped this headline: NHS England has told trusts in England they must begin to use the National Federated Data Platform within 2 years. Now that's quite significant because it's never been a must. It's been a would like to use. So that was yesterday. I've yet to see any response to that, but that'll be really interesting to see how that pans out, because that tallies with two of the things that were said. One is West Streeting wants the glacial pace of FDP adoption to improve. He wants GP data to be unlocked, but he's also said we need to take things on and potentially impose a more centralist view. So we'll see how that maps out, but that's fresh off the presses. The thing that we've talked about for a long time, data sharing and data access. If you're a researcher, it's been incredibly difficult, still is incredibly difficult to get access to data you need to do your research, which largely isn't identifiable in most cases, but there's a huge process that needs to be gone through. Good, because there includes really strict governance and checks and balances and assurances that the researcher only gets the data they need to do the job and it's bona fide research, but it takes a long time. And the problems with it, when data's been given away to the research group, they store it on their research computers within the university, and it's an extra copy of data with it's a sort of a fire and forget. The data is given to the researcher, and it's very difficult to find out what's happened beyond that. Just 1 second. I just want to admit another person to the waiting room. So the whole process in the past few months and years has been to move from data release to data access. That's where things like secure data environments, which we've covered in a previous session, you can rewatch that if needs be, come in. I put a few interesting little quotes at the bottom. So these are quotes I picked up from the Wired website. They are reported to be quotes from Wes Streeting. I haven't been able to verify that, but so take these with a pinch of salt, but they're in their press, been published. And it's around the privacy concerns, fight that Labour government's willing to have. I think it recognises that maybe privacy needs to be balanced with benefits. Hey, we've said that for a long time, and I think some of those things have now begun to get through, that having a large amount of data is fantastic, but it just means you've got a large amount of data. Unless you use that data and can put systems in place that allow the data to be used to generate benefit, insights that help us all, then it's no good. And the last one, again, language I wouldn't normally use. This is just a quotation from their website. The government refuses to take on their fear-mongering. So it sounds as if there's an appetite to push the balance of people, rather than just saying you must opt out, you must out, to give a much stronger balance to say, actually, we all have a responsibility that you should take really seriously, that our treatment was derived from patients who have been before us, and we've learned from their data what their health outcomes were, what their experiences were. And if we're going to improve health and treatments for those in the future, maybe it's incumbent on us to make sure our data is used to help people in the future, albeit with the right safeguards and monitoring and transparency. That is the Use My Data agenda, frankly. So it's really interesting to see that picked up. Some of the comments, these tend to be a bit England specific, but principles I think would the same apply. But he's basically saying, I recognise that patients are surprised when they find out that one hospital doesn't see the data that sits in another hospital about them. Hey, this has been around for a while now. This has been our topic for a long time. I don't think there's anything new in there, but it's been re-emphasised. Patients ultimately care about two things. Is my data being held securely, and is it being used ethically? Now, you need to caveat that. This was talking to a tech, a data audience. I suspect if you ask patients in the street, what's more important? It's about waiting times, getting access to your GP and other things. But just take that as in context. This was a comment he made for data tech specific audience. But he's made the point. Just 1 second. I said I'd mention the NHS app. Now, the NHS app plays a major part in policy moving forward. It's already got 31 million users. I think this was the last count across England and Wales. Brackets not Scotland, brackets not Northern Ireland. The aim is to transform the NHS app into, in the quotes from the policy manifesto, a one-stop shop for health information. I'm not a massive fan of one-stop shops, but you can see the idea that if we've got an NHS app, if it's working, if the COVID experience showed that people largely were willing to use these, there are all sorts of things about people who aren't digitally enabled or have struggled with using this sort of technology, but there's a real push to get the NHS app extended to include personal records, treatment guidelines, performance data, to enable you to book appointments. Hey, who knew? And invitation to participate in clinical trials, which goes back to one of the previous slides. So you can see how the NHS app has been seen as a very personal way for you and I to get access to more and more information. Now, again, devil detail. I've seen and been annoyed over several years now where people talk about, oh, of course, people can see their patient data because we've opened the NHS app up and you now can see your health record. Well, you can see your GP record and only part of your GP record. Those with complex conditions cannot see the rest of it. So if there's a real desire to do this, we need to keep the pressure on, as per one of our policy statements, our position statements about health records. Don't just stop at GP. It's wider than that. We'd like to see it all, please. What it does say is all health and care providers should publish into the NHS app. This is where the interoperability comes in. So in theory, if that were the case, then my local hospital up here and my hospital in Devon, if I happen to have been in there, would all have to publish data into the app about my care for me to see. A very simple thing to say, but a hugely complicated thing to do. If it was easy, it would have been done by now. But there's an intention there to say that's what we need. So I think we need to latch onto that and really push that hard. I've circled the thing about owned there. All the data will be owned by the patient. Data ownership is not something I'd really want to get into because in legal terms, it doesn't mean a great deal. But I think in from a policy perspective, this was a document meant for the public, for you and I. Data will be owned by the patient. I think in terms of that intention is quite a good thing, particularly when they say they could see it in one place. The other thing it did flag up is there a digital transformation fund, and that should be used to drive the development of the NHS app. So I think it's a good thing. Last couple of slides, I just thought I'd mention the King's speech, only because it was quite long. You can look on the full speech and the background briefing notes there. Thanks to Olivia for picking these things up as well. The only thing I really wanted to flag all there, broad consent for areas of scientific research. I don't really know what that means yet, but there is a clear push in the King's speech about we're going to push the data agenda forward. Again, we need to work out what these things mean. And the other point that was mentioned was reforming certain data laws to ensure high standards of protection. There are other details in there. It's worth a read through. It's quite long, but it's worth a read through because it mentions things like the role of the Information Commissioner's Office and other things as well. This is not just patient data, not just health data, it's a much wider general perspective that you get within the King's speech. On my last couple of slides, I picked up a couple of things around Scotland and Wales. So the Scottish Labour policy document is also committed to the joint working of between primary care through records and data sharing. So again, the data sharing thing is very strongly in Scotland. It has done previously. I think they're probably ahead of the curve on some of these things. And again, the life sciences, the data has the potential to transform our nation's healthcare. So Scotland have specifically picked up on that and said that's something for them as well. Wales, the word data doesn't appear anywhere in the Welsh policy document. So you might say, oh, they're not bothered. But actually, when you look at the way the structures work, England and Wales are largely tied together. So I think that it basically says we inherit what's in the larger UK document. But it didn't mention data anywhere in there, which was a bit of a surprise. The last thing I was going to mention was there's been an independent investigation of NHS performance, which has been commissioned by the government to be led by Professor Aradazi. Those of you long in the tooth might remember Aradazi from a lot of the work he did many years ago, which tried to pull together health outcomes data. So he's got a good history in trying to get health outcomes data used to monitor service performance, to monitor patient benefit and other things. So it's interesting that he's been picked to do that. I think it's a positive thing. And Sally Warren has been picked to work with her. Sally's been in the King's Fund for a while. She then was at Public Health England when I was there, actually. And they've been tasked to develop this review of NHS performance, which will include a large amount of data perspectives in there, and then feed into an overall, a longer-term NHS 10-year plan. So, there we go, almost exactly 30 minutes. There's loads of policy commitments in there, many of which relate to data or have an impact on data or are impacted by data. Lack of detail in lots of areas, which you might expect this early on in the government, but there are some good indications in there that this is a positive thing. Some initial indications about continuity, particularly in England, the federated data platform, secure data environments seem to be supported and want to be delivered, but there's huge amounts of devil in the detail, and our voices will remain essential, as already highlighted, particularly when areas are in line with our own position statements. So that was me done. I'm going to unshare, stop sharing, and open it up to you for questions, thoughts, arguments, other things. This is the last one until we get towards September. I need to send another schedule out from September onwards because I'm having some time off now in August. Yay. And I suspect you will be as well. So I'd just like to say thank you again for coming, giving your thoughts. Hope have a nice rest of the beautiful day. And yeah, a lovely summer. I'll see you in the bleak autumn winterness in September.